Welcome to Classics Confidential. I'm here in Hammersmith Hospital talking to Francesco Maria Galassi and Hutan Ashrafian, who are both medical doctors and who have recently published an article in the journal Neurological Sciences. Can you tell us the title of the article?
Has a diagnosis of stroke been overlooked in the symptoms of Julius Caesar?
So you're modern medical doctors who are reassessing some of the primary evidence for the sufferings of Julius Caesar during his lifetime in the light of new modern medical knowledge. So can you just, by way of background, can you give us some information about how Caesar's suffering is depicted in the ancient sources?
Well, it is absolutely clear that in the ancient sources, Caesar was depicted as suffering from a very terrible condition. And the main sources are Suetonius and Plutarch. The problem is that they use two different words. One is morbus comitialis in Latin, the other one is tois epilepticois enochos in Greek, used to epileptic fits. The point is that morbus comitialis is a far broader category, so it is not just epilepsy. It can mean almost everything having to do with falls or sudden losses of conscience. So we thought that perhaps Plutarch was interpreting that morbus comitialis, possibly coming from a Latin source like Oppius, Gaius Oppius, was one of Caesar's most intimate friends, translating it with epileptikos, which is a far narrower definition. So it is almost certain that Caesar suffered from fits, headaches, vertigo, and losses of conscience, and also psychomotor symptoms, like psychological liability, especially during one of the meetings of the Senate, as he was not able to stand one of Cicero's most famous orations. Cicero was a great orator, but I think that was not enough to explain the symptoms, but perhaps the professor knows something more.
So, I mean, you've been talking about how his illness was interpreted by other Greco-Roman authors, but I gather there's been quite a long history of people retrospectively diagnosing the disease in the modern age as well. Can you tell us, before we move on to your own ideas about mini-strokes, what are the other illnesses that people have attributed these symptoms to?
Well, clearly, as Julius Caesar is one of the most prominent characters of the ancient world, people have always attributed and tried to identify the diseases that he suffered during his life. Clearly, he was assassinated when he died, but during the course of his life, people have suggested a myriad of diseases, things that include epilepsy primarily, but in addition to that, people talk about Meniere's disease, which is a disease of the inner ear, maybe causing vertigo. People talk about infections of his brain that might have led to symptoms of vertigo or instability. People talk about genetic causes, or people talk about quite severe problems that he might have had in his stressful life that might have led to his attributes during life. So there have been many causes attributed to Caesar, but these haven't necessarily answered all the questions about what actually went on in terms of the actual original sources.
And so what do you think it was?
So we think, and I say we, Francesco and myself, feel that Julius Caesar suffered from cerebrovascular disease, and the symptoms of the cerebrovascular disease were noted several times in his lifetime. They're not necessarily the classical ones of the ascribed seizures of Caesar. We don't actually have such good evidence for that. But certainly we have evidence to suggest instability, vertigo, headache that came on episodically, particularly noted during the battles of Thapsus and Cordoba, and such. These episodes in a man who is a European, a warrior general, who is now in his 50s, the conditions that would present at such a time in his life would be in keeping with a condition where he would get furring of his blood vessels, particularly those of his brain, and he could suffer from what people call today mini-strokes, which are symptoms of entities where you have the blood vessels to your brain being limited temporarily, and then you recover from them. And these can manifest in terms of difficulties in balance, headaches, difficulties in vision, episodes of falling, and are suffered quite regularly today, albeit we have many treatments to manage them. At the time of Rome, when Caesar was around, the treatments might not have been there, and he might have suffered from these symptoms without necessarily understanding them to the extent that we do today.
And there is something more, if I can add it. There are recent studies suggesting that even mini strokes or transient ischemic attacks can cause neural damage, so that could affect his behavior as well. Although we know mini strokes to be not as tragic and severe as a full-blown stroke is. And strokes and mini strokes can imitate or mimic epilepsy and seizures in a way, so that could add to the confusion of medics of the day. And when it comes to his symptoms, I think the sources suggest that he was more of a patient suffering from stroke rather than epilepsy. And if you look at his family's history, we know that 2 of his forefathers died suddenly with no actual explanation. And those deaths were interpreted in terms of SUDEP, sudden unexpected death in epilepsy, which is very rare. But if you interpret them in a simpler way, saying that they were cardiovascular diseases, fatal myocardial infarction or stroke, and then you look at Caesar, you see that it is much more sensible and far simpler to think of him as a cardiovascular patient, to which if you look at Caesarion, who was the son he had from Cleopatra, I know there are some sources which say that he was epileptic. But those sources are 20th century novels, so there is nothing in the ancient sources. So to speak of a familiar tree of epileptics in his family, I think, is a bit complicated.
I suppose I was just wondering if we need to treat some of these sources with caution if they were writing after the event and maybe had their own agendas in, for example, showing Caesar as a very emotional person and responding in a particular way in the Senate, that kind of thing. It's quite hard to take them as just straightforward documentary, almost films of what Julius Caesar was like at the time.
I think that's absolutely a fair point. And of course, every ancient source at the time and post the event are liable to offer a degree of bias. Nevertheless, if we were to try and read through that and see that there are some core facts of a middle-aged man suffering from certain symptoms later on in life, whether or not they were used in terms of bias or propaganda to suggest he was a sacred man suffering from sacred diseases, or that from people who were against him saying that he was vulnerable to emotional lability, that's okay. We can try and consider that into our appraisal of the situation. Nevertheless, the cold facts of a middle-aged man from Northern Europe suffering from symptoms in middle age, and that persisted for some time and regressed and came back, do fit in very nicely with what we tend to suggest. Although, as you say, the causal proof is not absolute, and clearly we want to keep an open mind.
Well, I think that your work is certainly going to make people go back to those primary sources and look at them again, and it's just been really fascinating talking to you. So thank you very much
Thank you very much
for
indeed.
coming
Thank
on
you.
Classics Confidential.